Our last presenter for this session is Professor Otgontugs Banzragch from the Mongolia. You have waited too long, I think. And welcome and please step forward. Yep. And she will present us today about the significance of care economy in Mongolia. Let us give her a big applause.
Good afternoon, and my name is Otgo. I'm from National University of Mongolia, and I'm very pleased. I think it's an honor for me to be invited here to present about care economy in Mongolia to this important international conference, International Care Conference 2022. Okay. So I will start with a very short introduction of Mongolia and about its citizen. Mongolia is a small economy, open economy, and located between Russia and China, between two giants, and with very small population, 3.4 million people, and among them, about 1/3 of the population is nomadic population, which is nomadic herders. So we have such a big responsibility to provide care for not only for the total population, but the people who are moving around the location 4 or 5 times per year. That's the huge responsibility as a policymakers of this country, I mean Mongolia. So capital city is the country is becoming very urban. About half of the population lives in capital city. And we have great pride, we take great pride that in our achievement of preschool education coverage and primary and secondary school coverage. And also we observing a reduction in child mortality rate, which is very good news for us. But we're having a problem with rising rate in the maternal mortality rate for the last few years, which is very disturbing news for us. And retirement age about Mongolians is about very early. They're retired. For women, it's about 55. For men, it's 60 years old. And average life expectancy for women is much longer than men, about 10 years difference. So I'm the economist, and that's why I would like to very shortly to talk about economy, macroeconomic situation in the country. The GDP per capita is about $4,000, and economic growth is declining. Like in everywhere in other developing countries, we are having very small rise in our economic growth. It's about last half year we observed 1.9%, and we're expecting that economy will grow about 2% in this year. So we have 1/3 of the households are living below poverty rate, and Gini coefficient is not declining. It's about 1/3, 0.34, 35, 35 or something. So economic situation is worsening, like Professor Delaney said in Sri Lanka, as well as in Mongolia, because of the COVID, in rising external debt, and low economic diversification, and shortage of very productive employment, in very poor environment for small, medium-sized enterprises, the rising trend in public sector's corruption. All these are factors that are contributing very unfavorable macroeconomic situation for the care economy. Female labor force participation rate is lower than for males. It's about 49%, and for men it's 66%. and labor market is very segregated in Mongolia. As Delaney said, we also have a gender wage gap in Mongolia. It's about, depending on the data that researchers have used, it is different, but between 16 to 20%. So here I'm presenting population pyramid for the for current 2020 and for the future 2050. As we see from these two graphs, we can see that we will have demographic shifts in the future. We will have huge demand, rising demand for care, for elder care especially. So, and also we are observing very rapid urbanization in Mongolia, and also for females, they have higher level of educational attainment compared to men. All these three factors are contributing for the but very sure rise and increase in care demand in the future in Mongolia. So here we see the fertility rate. It was the highest fertility rate we observed in 1950s, 1960s. Since then, it's declining, and we observed the very, lowest level of fertility is 2005, which is 1.65. After that, it was increasing. But when I observed the last statistics, it's also started to decline because of COVID-19, because of this uncertainty in macroeconomic situation. So all these factors are giving signals to us that we need to think about more carefully about the care economy planning. So what we get as researchers, where we do get data to analyze and provide policy tools to policymakers, are this data, survey data about that comes from Mongolian Time Use Survey. We have the National Statistics Office provided 5 national Mongolian time use survey, and next year, 2023, they will organize that sixth survey of the time use survey. That is the excellent source of the estimation for the care, unpaid care work by location, by gender, by age, by marital status, employment status, by marital status. So a second data source that we have is multiple indicator cluster surveys, and also labor force surveys that the National Statistics Office organize every year. So on unpaid care sector, we have these numbers of this kind of surveys that we can use. But on paid care sector, we have not so much sufficient data, but we have usually administrative data from the Ministries of Education and Ministries of Labor, Ministry of Labor and Social Protection, and the Ministry of Health, and also from the National Statistics Office. The National Statistics Office also organized the Household Socioeconomic Survey every year. So from that survey, we can get some numbers on paid domestic workers. That's why we are able to somehow to estimate the size of the care economy in the country. So on the paid care economy, paid care sector, the country is investing how much, where they invest, and how they invest. We can get information on that issues from that social insurance programs, from the social assistance programs, and also labor market programs, and also from the education policy, and the pension policy, and health insurance policy. So here I present some statistics some estimations that we made using Mongolian Time Use Survey 2019. From here we can see that from the survey, about 2,533 individuals were engaged in unpaid care work in their respective families. If we will discount it into the total household, total population sample, we estimated that about 18.7% of total adult population are engaged in unpaid care sector, from which 70% are women and 30% are men. And also children also are caregiver, and we estimated that, and also we observed that how many percentage of these caregivers in unpaid sector are providing double care, which means caring for children and elderly at the very same time at their families. So here we estimated how much adult Mongolians spend on elder care. We can see that we can see that women spend more time on elderly care, regardless of their location, urban or rural women, compared to men. So here we see that on the right side on the slide, rising rate of elderly population. We see the total population growth rate is about 1.8, 1.9, but growth rate of the elderly population is about 6.0 every year. So which means that there is increasing need for the care in the country. We do have very insufficient data and information on care for disabled individuals, including children with disabilities. So we need to work more to get more information on the care of this type. Here I'm going to talk about a little bit about paid care sector. Paid care sector. Paid care sector usually we focus at the moment for our research. We are focusing for the children aged from 2 to 5, because according to education law, in law of preschool education, they allow children aged from 2 to 5 are eligible for free of charge public kindergartens. Kindergartens are kind of combination in Mongolia, combination of preschool education together with the daycare. So they run from 8 a.m. to 6 p.m. Every working day from Monday to Friday until 1st of September and until 1st of June every year. So the government is spending about 20% of its education budget on the preschool education. So we can see that the paid care sector is increasingly, compared to other sectors, is larger than compared to other sectors like transportation or healthcare. Here on this slide, I'm showing that the budget spending, expected budget spending of the central government of Mongolia on care-related activities by respective ministries, like Ministry of Education, Ministry of Labor of Social Protection, Ministry of Health, and including the pensions, other social insurance, health insurance spending on, social assistance spending from the budget money, in total amount for this care-related sectors, and total expecting GDP number. And we just ordinary calculation will give us from the paid sector the total public into care sectors about 21%, 21.5%. But we dig deeper into that numbers, and we came out about caregiver paid care sector paid by taxpayers' money is about 4.9 to 5.6 of the total GDP in Mongolia. Okay, and here we can see that the size of the significant, increasingly significant, becoming the care sector in the Mongolia. It's about care service expenditure of public spending money is about 4.6 and 5.1% of the GDP. And I know that from other research that done by other researchers like Professor Elizabeth King and Maria Flora, they estimated using time-use survey of 2015, it's about unpaid care work sector is valued about 15 or 16% of the GDP of Mongolia. So if we can come with the total number, it's about 20-something, more than 20% of the GDP is produced in care sector. Compared to other countries like Colombia or Japan, Canada, South Africa, US, it's about around the 20. We are spending the very similar the size, having a similar size of the care economy. We're paid and unpaid. The care sector is very important for well-being, humans' well-being, individuals in the society. So we are thinking that in Mongolia, continue the research and continue to provide policy tools for the policymakers using our this research in incoming research, and try to follow international organizations' directions in research findings on 5R framework: recognition, reduction, redistribution of unpaid care work, and rewarding those who work in this sector, and also enable their representation in national and local policy making. Thank you.
Thank you so much. Thank you. It was really good to know about the situation in Mongolia.